Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Then the next drug is cilostazol. Cilostazol is actually a phosphodiesterase 3 inhibitor, and this is a phosphodiesterase 3 inhibitor. Thus, it causes vasodilatation and also inhibits the platelet aggregation. It causes vasodilatation by the activating or increasing nitric oxide, and it also inhibits the platelet aggregation. So this cilostazol is mainly used as an adjuvant in anti-anginal therapy, and it is mainly reserved in the treatment of intermittent claudication. It can be used in the treatment of intermittent claudication.
thank you and thank you for watching.